Hello and welcome everyone to Ask My Doctor, an exclusive Q&A session sponsored by My American Doctor. And we're honored to have Dr. Kiran with us today. He is a pulmonologist, a sleep care specialist, and a critical care specialist. That is so much. Like, how do you manage to keep ahead with everything? Like, how do you manage to fit everything into a 24-hour day?
That, Fortunately, I think we work in a kind of a weekly basis on different disciplines, but actually it helps to keep your sanity a little bit. So because I'm working as a pulmonologist, critical care specialist, and a sleep doc. Basically, I get a kind of, if I get bored with one or stressed out with one, I get to jump to something else. So in the three worlds, basically, the critical care is most stressful. Obviously, when we are doing critical care, we are seeing obviously life-threatening diseases, and patients are really sick with a lot of ventilator requirements or basically life-saving devices. And it's obviously 24/7 call. So we're basically for a week, we do weekly shifts. So basically for a week we are on call, and then after that kind of jump to either outpatient world, seeing pulmonary problems, or basically going to sleep problems. So that kind of gives us some breathing room so that we go back to critical care when we are ready.
Mm-hmm. And before we get into the questions, could you tell me a little about yourself? I hear that you studied in Gandhi in Hyderabad. I live in Hyderabad. I love this city. Do you miss Hyderabad?
Of course, of course. Homeland is always like whenever I go to Hyderabad, I always tell my wife basically the air is different. I mean, as soon as you get out of the flight, you feel it. So definitely miss it. Yeah, I'm from Gandhi, finished in '95. Came to US in '97. Did my residency in Pittsburgh, and did my fellowship in pulmonary critical care and sleep medicine at Ohio State here in Columbus, Ohio.
Mm-hmm.
And since finishing fellowship, I'm here at Grand Medical Center, Columbus, Ohio, which is a downtown trauma center. So I run the ICU here, and I lead the group of about 11 to 12 docs now, and about 30 people, including nurse practitioners and staff. So keeps pretty busy, but it's fun. I still like doing critical care, and when I'm in the critical care, I feel alive. So.
Mm-hmm. Thank you for making the time for us. I can't imagine how busy you are. And coming back, what do you think is most different? 95. That's quite a bit ago. What do you think is most different here now? 95. Have you visited here recently?
Yeah, actually, in fact, I just came to India March first week. My dad's 80th birthday, and we went to Tirupati, and it was a good, yeah, good 1 week, short week. But yeah, I mean, it's amazing how much transition Hyderabad has gone through
Mm-hmm.
since last 2 decades. I mean, I tell like if I did my medicine now, probably would stay back there rather than come here because there's so much of growth and there's so much of need for docs there.
Mm-hmm.
But when we finished medicine, the best job was paying like 5,000 rupees as a house doc, and basically there wasn't much. There was so much of competition to get into MDs and DMs, and it was hard. So obviously look for a better place for education, which actually we don't regret. This is a good place to learn medicine, but definitely feel that definitely miss Hyderabad and India.
Mm-hmm. No,
That's the
it's
reason.
okay. I get it. I think the
That's one of
hallmark.
the
That's okay.
reasons.
Mm-hmm.
Sorry, that's one of the reasons we like to do this, to do the second opinion, so that we give back something to the country.
Mm-hmm. That's really nice. But I get it. I think like the hallmark of like a true Hyderabadi is getting out of Hyderabad, like going to the US. That like really seals it in.